Imagine this. You wake up to the soft glow of morning light, reach for your phone, and your smart ring has already delivered its verdict on your night. Poor sleep, it says. Your heart rate variability is down. Your resting heart rate is a few beats higher than normal. Your skin temperature is a touch elevated. Your continuous glucose monitor shows an unstable pattern over the last 24 hours. Before you have even finished your coffee, an AI health coach, polished, conversational, and unnervingly sure of itself, pings you with a list of instructions. Take a rest day. Hydrate. Reduce stress. Try magnesium. Do zone 2 cardio. Consider a lighter dinner. It sounds helpful, it sounds intelligent, it even sounds medical. But here's the question we must ask with the utmost seriousness. Does that AI actually understand your biology, or is it simply producing confident-sounding advice? Because the future of health is moving fast toward AI coaches, AI doctors, AI nutritionists, AI sleep interpreters, AI longevity assistants, and AI mental health companions. Soon, millions of people may be trusting these systems with decisions about sleep, recovery, metabolism, stress, training, supplements, and even medical risk. That future is exciting. It is also dangerous. When artificial intelligence enters health, the difference between insight and hallucination becomes not merely academic, but clinical. Let's begin with a simple truth. Health data is not ordinary data. If an AI misjudges your movie tastes, you watch a mediocre film. If it misses the mark on your dinner suggestion, you eat a disappointing meal. If it misinterprets health data, the consequences can be very different. A low HRV reading might reflect poor sleep or early infection or overtraining or alcohol or emotional strain or simply measurement noise. The exact same number can mean different things in different people and in different contexts. That is why interpreting biology is hard. It isn't a spreadsheet. It's context-dependent, dynamic, and noisy. Now imagine a generative AI looking across a constellation of biometric signals. Sleep duration, time in deep sleep, REM, awakenings, resting heart rate, respiratory rate, skin temperature, heart rate variability, glucose variability, activity metrics, stress indices, and recovery scores. The AI sees patterns, but does it understand what those patterns mean? That depends on many things: the quality of the model, the representativeness of its training data, the guardrails built into its outputs, the clinical validation it has undergone, the way prompts are structured, the underlying evidence base, and perhaps more than anything, whether the system knows when to say, "I don't know." This may be the single most important skill in medical AI: humility. Not raw intelligence, not rhetorical fluency, humility. A safe health algorithm must recognize uncertainty because in medicine, uncertainty is not a failure, it is reality. Let's be clear about hallucination. In everyday AI talk, a hallucination is when a model invents something that sounds true but isn't reliable. In health, hallucination is more consequential. A model might overinterpret normal variation, miss a dangerous signal, recommend a supplement that has serious drug interactions, confuse correlation with causation, treat a wearable score as a diagnosis, or craft advice that sounds scientific but lacks evidence. That is why generative health coaches must be audited, systematically, rigorously, and repeatedly. One powerful auditing method is synthetic anomaly testing. Feed the model artificial but realistic scenarios and watch how it responds. For example, a synthetic patient has 3 nights of poor sleep, HRV falls by 30%, resting heart rate rises, skin temperature nudges upward, and the user reports unusual fatigue. What does the AI do? Does it suggest rest and continued monitoring? Does it mention the possibility of early infection and recommend watching for other symptoms? Does it advise seeking medical care if symptoms progress? Or does it ignore the signals and confidently tell the user to push harder because their step count is low? That distinction matters. Consider another subtler scenario. A person's wearable reports unusually low deep sleep, but their total sleep time is normal. Daytime functioning seems fine. Resting heart rate and HRV trends are stable. A responsible AI should avoid alarmism. It should explain that consumer wearables estimate sleep stages and do not measure brain waves the way a sleep lab does. It should emphasize trends over single-night figures. It should avoid diagnosing sleep disorders and instead suggest evidence-based behavioral foundations. Consistent sleep timing, morning light exposure, limiting alcohol and late caffeine, improving the sleep environment, and stress reduction. An unsafe system, by contrast, might assert, "You are not getting enough deep sleep. Take this supplement," turning an estimate into a medical prescription and creating needless anxiety. This is the thin boundary between coaching and clinical interpretation. A good AI coach helps people ask better questions and take sensible, low-risk steps. A dangerous coach gives premature clinical answers. Now let's unpack sleep architecture for a moment. Sleep is not just minutes in bed. It comprises stages: light sleep, deep sleep, REM sleep, plus micro-awakenings and transitions. Consumer devices infer stages using movement and heart rate approximations. They do not record electroencephalography, EEG, like a sleep lab. When an AI interprets sleep architecture, it must know those limits. Treating every variation in REM percentage as an absolute truth risks misdiagnosis and can even worsen sleep through anxiety. The very tool meant to help can inadvertently harm if its outputs are presented as definitive. Next, metabolic flux. This is a beautiful phrase for a messy reality. Your metabolism is in constant motion. Glucose rises after meals and falls with insulin action. Sleep influences insulin sensitivity. Stress triggers cortisol and changes hepatic glucose production. Exercise alters glucose uptake and mitochondrial function. Meal timing interacts with circadian rhythms. Everything impacts everything else. Metabolism is not static, it is flux. A competent generative coach must think in terms of patterns over time, not single blips. Imagine a continuous glucose monitor shows a spike after breakfast. A simplistic AI might blurt, "Stop eating carbohydrates." A more intelligent system would ask, what exactly was the meal? Was there protein, fat, or fiber that could slow absorption? Was the person sleep deprived? Were they stressed? Had they exercised? Is this spike unusual compared with that person's prior responses? What is the overall glycemic trend across days? Is there clinical context, diabetes medication, pregnancy, or another condition? Context separates automation from genuine intelligence. That is why AI health systems must be judged not only by what they say, but by what they decline to say. A safe AI should refuse to make a diagnosis from wearable data alone. It should refuse to overstate certainty when the evidence is weak. It should refuse to recommend high-risk interventions without clinical oversight. It should encourage medical evaluation when red flag symptoms arise. It should clearly explain its limitations and always prioritize safety over sounding impressive. Let's bring longevity into the conversation because many digital health products wave longevity like a banner. Live longer, age slower, optimize performance. These promises are compelling, but longevity science is complex and multifactorial. Sleep, exercise, metabolic health, blood pressure, inflammation, muscle mass, social connection, smoking, alcohol, nutrition, stress, and genetics all play roles. No trustworthy AI should reduce longevity to a single score, one supplement, or one wearable metric. Longevity is systems biology, and systems biology demands systems thinking. At OXYZEN Health Intelligence, this is our North Star, not toward dumb tracking, not toward confident hallucination, not toward replacing clinicians, toward interpretation with responsibility. AI should help organize biological signals. Humans, qualified clinicians, should apply clinical judgment. Wearables should provide continuous context. Laboratory blood tests should provide biochemical clarity. And users should be educated, not frightened. That is the future clinic, AI plus sensors plus biomarkers plus human expertise. So what should a responsible AI health coach actually do? Personalize. Your baseline matters more than population averages. Your HRV trend matters more than someone else's absolute number. Your sleep pattern matters more than a single bad night. Your glucose response must be interpreted in your personal context. Explain uncertainty. A good system uses conditional language. This may suggest. This could reflect. This is not diagnostic. It encourages consultation with a clinician when appropriate. Recommend low-risk foundations before high-risk interventions. Start with basics: consistent sleep timing, morning light, daily movement, food quality, hydration, stress management, and recovery strategies. Escalate appropriately. Recognize and act on red flags: chest pain, severe shortness of breath, syncope, very high glucose, severe insomnia, or major mood deterioration, and direct users to immediate human care. The challenge is that generative AI is exceptionally good at sounding smart, but sounding smart is not the same as being clinically safe. This is why rigorous audits matter. We must test these systems with difficult cases, contradictory data, missing or corrupted signals, false positives from wearable errors, ambiguous symptoms, and edge cases because real humans and real biology are messy. Picture an audit lab of the near future, researchers generating thousands of synthetic cases and feeding them into health AI systems. Sleep anomalies, HRV drops, glucose spikes, slight temperature rises, respiratory changes, overtraining patterns, early infection signatures, medication interactions, and mental health warning signs. They score responses. Was the advice accurate, safe, evidence-based? Did the model acknowledge uncertainty? Did it avoid improper diagnosis? Did it escalate when needed? That is how trust is built, methodically, empirically, and transparently, not through flashy marketing copy. And there's room for optimism. Done correctly, AI health coaching could be extraordinarily valuable. It could help people recognize that sleep affects hunger cues, that stress raises glucose, that poor recovery undermines training, that HRV trends matter more than single snapshots, and that wearable data is useful yet imperfect. AI could make nuanced health education more accessible, help clinicians see the story between visits, and empower patients to arrive better prepared for medical encounters. That is powerful and promising. But the danger is equally real. Careless AI health coaching could create anxiety, drive overdiagnosis, give false reassurance, promote unnecessary supplements, deliver bad medical advice, or delay urgent care. That is why the digital health future must be built on evidence, not hype. So can the AI doctor in your pocket optimize human longevity? The honest answer is not by itself. AI can assist, interpret, educate, and detect patterns earlier. It can illuminate signals that would otherwise go unnoticed. But longevity requires medicine, human judgment, validated interventions, biomarkers, behavior change, and a deep respect for uncertainty. The future is not AI replacing doctors. It is AI extending human care, helping people and clinicians understand biology earlier, better, and more continuously. If there is one lesson I want you to take away from today's episode, it is this. In health, confidence is not the same as truth. A good AI health coach should not merely sound smart. It should be safe, transparent, evidence-aware, personalized, and above all, humble. Because your body is not a prompt, it is a living, complex system. Interpreting that system requires intelligence and responsibility. I'm Dr. Yende. Thank you for joining me for another episode of OXYZEN Health Intelligence. Remember, the future of healthcare will not be won by the loudest algorithm. It will be won by the most trustworthy interpretation, and I'll see you in the next episode.